Welcome back to Empowering You here on WSNC 90.5 FM with me, Alvin Atkinson. We are continuing our conversations with guests from Forsyth County or who work closely with the county. And next up, we have Miss Jennifer Graziano, who's from the American Heart Association, where she's the Senior Community Impact Director. Good afternoon, Jennifer.
Hi, Alvin. Thanks for having me today.
Well, you know, that name Jennifer is special to me because my daughter's name's Jennifer.
Oh.
So I always have a smile comes on my face whenever I say Jennifer. So I'm smiling quite a bit. But you're here, and I understand that there was something that you have done recently with the Department of Public Health. What was that?
Yeah, so recently we had an awesome opportunity to donate 17 CPR Anytime kits to the Forsyth County Department of Public Health. And what these kits do is they train the community in hands-only CPR. That's the chest compression part of CPR. And it gives them everything they need to learn the life-saving skills of CPR, how to use an AED, and choking relief, and can be reused repeatedly.
Well, I believe we had someone on before who brought that little dummy and did the exercise for us, and I think that's great because the more people we can get trained, the more we can save.
Absolutely.
Now, can you tell us then how common is cardiac arrest in our community?
Yeah, so in the United States, there's about 350,000 sudden cardiac arrests per year that happen outside of a hospital setting. So that's at home, that's out in public, that's in your residence. In Forsyth County, there was about 350 to 400 cardiac arrests in 2023 that were non-traumatic. So it's pretty prevalent.
Yes, that's a good number. And if we're able to save their lives or find that would be great, and I'm sure, or we have. But I understand also that some groups are sort of difficult, and I would imagine African American groups, you know, we get a little leery of things. So how can you help us to become more confident and comfortable saving lives?
Absolutely. So you're right. There are some disparities in our community around bystander CPR. Unfortunately, you see lower rates of bystander CPR in Black and Hispanic neighborhoods, in women, and the elderly.
Wow. So, and all those are groups that I would think they're at risk for cardiac arrest.
Absolutely. You're right. Specifically, if you're in a lower income neighborhood, you are at a higher risk of cardiac arrest.
So, given that that's our status and a situation in our community, how do you go about having impact with what you do in your job?
Learn hands-only CPR. It is simple. There's a big misconception that you have to be certified in CPR to perform CPR, which is not true. Anyone can be a lifesaver. And so we want to make that known. You don't have to have formal training that you walk away with a certificate to save your loved one. 70% of cardiac arrests happen in your home. I don't know who's in your home, but for me, that's my spouse. That's my children. That's someone I care about and love, whose life I would be saving. And there's 2 steps to hands-only CPR. Number 1, call 911. And number 2, push hard and fast in the center of the chest.
You know what? I'm learning something. When you said hands-only CPR, I'm like, wow, I wasn't expecting that. But I remember the demonstration that it was just hands-only. And I think that there's maybe some misconceptions about CPR. Mm-hmm. How are we getting the word out about the need to do this?
Yeah, so if I can, I'd like to share with you a little research that the AHA did.
Okay.
So we asked, it was a nationwide survey, and we asked bystanders, why did they not perform CPR on someone who was experiencing cardiac arrest when they had the chance to? And you might be surprised by some of these answers.
Okay.
The biggest one was people feared legal ramifications. Am I going to get sued for trying to save someone's life? But luckily, we have Good Samaritan laws in place that protect you from any legal ramifications. They were also afraid that they might hurt the person. And they were also afraid that it's too complicated, or I don't want to give the rescue breaths, or I'm not formally trained in it. Am I allowed to perform CPR? And absolutely you are. So that's why we're here saying it loud. We want every household to have at least one person trained in CPR, regardless of where you live.
Well, in listening to the results, you just demystified all that I was thinking about CPR, or perhaps others in our audience were thinking about CPR. And so how can we really now become even more educated and get information to help us become really be that resource for our family members who might experience cardiac arrest?
How to be a lifesaver, right?
How to be a lifesaver, yes.
Yeah, so you can either take a CPR course that you might walk away certified in CPR, or you can just learn hands-only CPR by going to www.heart.org/CPR.
Online learning, right?
Online
Going right
learning,
there, hands-free CPR. What else? Any other bits of information you want to share with us? Because I've gotten educated, and I know our listeners are as well. But please help us. Anything else?
Just know how simple it is. Know those 2 steps. Number 1, call 911. And step 2, push hard and fast in the center of the chest until professional help arrives.
Great. Well, I want to thank you for coming and helping us to share information that can save lives.
Thank you.
Great. Thank you.